So I was taking a walk with my friend Kjetil the other day, and he was telling me about some knee pain that he was experiencing that has been preventing him from running and cycling and doing a lot of things that he loves for like the last 9 years. So having dealt with a lot of those issues myself, I wanted to prescribe him some mobility exercises that helped me quite a bit, especially in that IT band kind of outer knee pain region that impacts a lot of different endurance athletes. So his prescription is a series of 5 different exercises that I'm going to show you how to do today. The first is the couch stretch, which was developed by Kjetil of Ready State, or formerly Mobility WOD. Essentially, you're going to park your knee as tight as you can up against the wall and bring the other leg up. And you can hang out here for a while and just kind of feel what that feels like. But ideally, you want to get yourself up into a full expression of the couch stretch. I sometimes like to have something here to kind of help hold myself up. Definitely want to try to keep your glutes engaged in this motion, as well as your abs turned on to create a whole stable system, so you really feel that opening in the hip flexor as well as that quad, which we're really focusing on, is really kind of warming up and loosening that quadricep muscle. So that's the couch stretch. Kjetil, I want you to hang out here for 2 to 3 minutes per side. It does get very uncomfortable, but that's where the change happens. So that's number 1, couch stretch. Number 2 is some type of rolling, some type of myofascial release across that same quad. I like to use the rumble roller. It's a little better than most foam rollers. You can also use a rolling pin, which works great, as well as a lacrosse ball, probably a little bit deeper penetration with the lacrosse ball, but even a wine bottle works fantastically. So essentially we're gonna just take a roller up and down that same quad and just get basically from that knee up into the hip and get that whole upper leg really loosened up. So that's phase 2. Phase 3, we're gonna introduce the voodoo floss band. So this is another kind of trick of the trade from Kjetil that you can apply on most joints or muscle groups. In this case, again, we're focusing on that knee. We're going to wrap from the outside in. And essentially, in terms of tightness, you go about 50% of its elasticity, or about double of its natural elasticity. But I really kind of take this to the extreme. So you really want to get it to a point where it's very, very tight and uncomfortable, because that's ultimately where the change occurs. And in this particular application, we're going to do below the knee for a few reps. And then once we get just under that kneecap, we're going to take it above the knee. You can wrap the entire knee. That can also be effective. I find you can get into a little bit deeper ranges of motion by just doing a wrap below and above. And once you get about to the point where you have a little bit left, you just want to kind of tie it off loosely underneath the last wrap so it stays in place like so. It's kind of a sloppy job, but once that's wrapped nice and tight, you go in and out of some ranges of motion. So we just can take it to a deep squat, and that's where it feels very uncomfortable, but that's where we're really restoring a lot of that fascia to be nice and slick, not as much friction. And an alternative that's maybe a little bit more comfortable is, just kind of laying down and doing some knee extensions like that. You can kind of play around with that. I've even seen people kind of go into this expression, which is very, very uncomfortable. But the floss band technique is by far one of the most effective when it comes to managing and dealing with knee pain. But like I said, you can also use this floss band to address, I have tight hamstrings, so I'll oftentimes wrap that whole region and do squats and different motions to restore some gnarly hamstring issues that I tend to deal with. You can do calves, ankles, you name it. This is a magical tool that you can find on at roguefitness.com. The next fourth exercise is basically a deep squat. So essentially what we're doing is getting deep into a squat and just feeling around any kind of clickiness or anything that's kind of deep into the groin and hips that we might need to address with other exercises. So this is kind of an experimental sort of a discovery exercise, if you will. And we can also kind of level this up a bit by adding some weight. And again, just feeling around for anything that might be catching or clicking. And meanwhile, we are creating some change in those hips as well as our ankles. And that's going to kind of prime us for our last phase, which is kind of more a strength building and stability phase, in which we can incorporate some squats if we'd like to kind of build up those glutes, maybe even some deadlifts. But more importantly, we really want to focus on single leg stability, which is oftentimes the culprit to knee pain, is biomechanical or movement dysfunctions that occur in the hip region, as well as maybe even the ankles. So one of the most simple yet effective little motions that helps with this is just pivoting out, doing little toe touches. That's going to really help the inner thigh, groin area, as well as glutes, and that sort of stability, as well as kind of a twisting little dip squat. These two I practice every week just to make sure I'm strong and stable for running and cycling, etc. So, Kjetil, that's your mobility prescription. Best of luck on breaking that injury.